And I must say congratulations, Dr. Piali. As usual, that was an excellent presentation. Um, you always give me, such a challenge that I have to rise up to it. So thank you for the organizers for taking up this topic today on nutritional conclave. Thank you also to our Dean, Dr. S.K. Mishra, who told us very inspiring words in the beginning. And so, coming to my topic for today, obesity is actually a huge, very vast topic which has medical, social, and psychosocial connotations. And it's a challenge for an endocrinologist, for a cardiologist, for a nutritionist, for so many people. So, I will try to touch upon the salient aspects of each. It's a post lunch hour, trying not to make you all sleep, but trying to keep you all interested. So, coming to the topic quickly, as we all know, we all evolved into erect humans, and then television and McDonald's and Burger King made us become couch potatoes like this. My slides are visible to everyone, and I am audible.
Yeah, it is
Yes,
audible.
Prerna,
It
you're
is
audible
visible.
and visible.
Okay. So
Carry
we
on.
will just quickly discuss obesity, overweight, Indian data, how to diagnose obesity, what are the consequences, etc. So as we all know, but just repeating, obesity is a medical condition in which there is excessive body fat, which has accumulated over the years to such an extent that it causes adverse health effects. Now, it must be emphasized it is multifactorial. Hi, Rama. Finally, we can see Rama. Obesity is multifactorial. That's why it's difficult to control. At the same time, it is very much preventable. So we should talk about that. Now, to diagnose it, there are some very complex techniques. Out of all the ways of measuring fat levels, skin fold thickness is one of the simple ones, but there are more difficult techniques also. But these most standard ones which we take are BMI and WHR, that is waist hip ratio. Now, BMI is just your kilogram body weight divided by your height in meters and then square. Every calculator, every computer will have the BMI calculator. You can just put in your height and weight and you get your BMI. It will come to a number which will be hopefully something between 18 and 30. And so the obesity and overweight, they are both on the same spectrum. One is before, the other is after. So now coming to, this is a very important chart, and I urge you all, even though you know it, but to give us some attention to this. When the BMI is less than 18.5, the person is underweight. This is not our topic for discussion today, though that may have its own problems. 18.5 to 24 roughly is the normal BMI. Above 25 is overweight, and above 30 is obese. Above 40 is very, very obese. So, but now the important point is that for Asian populations, we have to take lower cutoffs, because in our populations, the problems associated with obesity and overweight start at a lower cutoff. So we take 23 and 25 instead of 25 and 30. This is something which we must remember in our population, that after 25 BMI, we are obese. We are going to have the same problems as any obese person in a Western country will have. Now, why are we even discussing this? Sorry for this slide, it's got a bit hodgepodge. Worldwide, the number of obese people has tripled since 1975. And this is a very recent data. And over 650 million people in the world were found to be obese. And nowadays, it is being seen that in a lot of countries, more people are dying of overweight and obesity problems than of underweight. Now, the problem in India is that we thought of India as a country where malnutrition problems were in abundance, like Dr. Piali just told us. And now we have this dual problem that now we have obesity also in India. So it is a double burden. Both are malnourishment conditions, undernutrition and overnutrition. Likewise, in children, this has become an epidemic, and it is a matter of concern why our children are getting obese. So in children, the BMI above 95th percentile is considered as obese for that age and that gender, because children are growing. So there will be different BMI cutoffs for each age and of course for both genders. So when your BMI is more than 95th, you are an obese child. Now in India, now worldwide, less than 5 years, mate, this is worth noting, 38 million children are either overweight or obese. As we'll talk about it later, what are the health problems that children or adults will have when they are overweight or obese? So, in the Indian data, India has the second highest number of obese children in the world, next to China. And the prevalence of overweight and obesity is 15%. Like, that's really, really high. In private schools in India, they did a survey in class 10th, 11th, and 12th and found that actually 33% of the children were obese. Because here, see, I said 15% in the earlier slide, that was obese plus overweight. Here we are talking about obesity, and here we are talking about affluent children in the metros. So they were found to be, those many children were found to be obese. Now, like I said, we are already the diabetic capital almost of the world, and now we are becoming diabesity. There is diabetes, there is obesity. And this is when we used to have malnourishment. So obesity occurs over time because of multiple factors. The the most simple way in which we can understand is CICO, calories in, calories out. How much I ate, how much I burned calories by my daily activities. How many times I skipped in the day, how many times I took the lift, how many times I walked up the stairs, how much I walked inside my house, how much I ran after my dog. All this is calories out. How much I ate throughout the day, including the fruit juice, colas, everything, that is the calories in. So the factors which, there are certain factors which may tip the balance. So we come to that. So like I said, obesity is multifactorial. The very important thing is genes. We all talk about this, this runs in my family. So one is that genes will affect the way you store fat in your body, how that fat is distributed. Likewise, how efficiently you are able to convert food into energy, how your appetite is regulated, how much you are able to burn calories, but also not just because of the genes we share. Dr. Piali had said that environment actually is very important. So when we say obesity tends to run in families, it is also because family members are going to share similar eating and activity habits. अगर मम्मी नहीं बैडमिंटन खेलती है तो पापा भी नहीं खेलते हैं, पापा नहीं करते हैं तो बच्चे भी नहीं करते हैं, बच्चे नहीं करते हैं तो बड़े भी नहीं करते हैं, बड़े नहीं करते हैं तो बच्चे भी नहीं करते हैं.
Ma'am, you are not audible.
आई थिंक हर नेट हैज उसका नेट शायद चला गया है. लेट मी गिव हर अ कॉल.
Unhealthy people go out to eat very
She's
often.
back.
They have fast food. They will have high calorie beverages, very big sized portions. Then liquid calories in the form of alcohol, sugared soft drinks, even so-called fruit juices. Then inactivity, sedentary lifestyle, like we know in Corona times, screen time itna बढ़ गया है सबका, so that is adding to it. Then there are some diseases and some medicines also which lead to gain in weight. For example, there is Prader-Willi syndrome, relatively uncommon. There is Cushing's. I wanted to emphasize that there are certain medical problems such as arthritis. For example, if a person has pain in their knees or ankles, they are unlikely to walk much or exercise much, so they will have weight gain. At the same time, the weight gain is going to stress their joints further. So it becomes a vicious cycle. Likewise, some medicines like antidepressants, anti-seizure medicines, some of the medicines for diabetes, not all, antipsychotic medicines, steroids, and beta blockers, which are used for hypertension. These also lead to weight gain. We must remember this. So the person who is taking these medicines, we have to tell them how to balance this out with a healthy diet and increase in their activity levels. Then there are social and economic issues. A very important point in our country, which we don't think of so often, is how can you walk if you don't have a safe area to walk or exercise? We know that in the rural or lower socioeconomic classes also obesity is increasing, but they may not have access to safe walking areas. They may not have the capacity to buy good quality shoes, which are quite important for walking. Then if in a family they have never thought of healthy ways of cooking, they think that having bread pakoras for breakfast, lunch, or dinner is fine. And the next day that they must have chola bhatura for all three meals. We all know such families. I'm exaggerating a little bit, but Rama sits with me in General Hospital. We know people who eat 8 samosas per day daily, and they say that they are not going to stop that. So these are important factors. Then there are the people you spend time with. If you are around with active people, who think, who indulge in exercise, who talk about healthy eating, then you also tend to become like that. Otherwise you also tend to develop little habits which lead to obesity. Then age, of course, like we said, that in children it's becoming something of concern. But with increasing age, your muscle mass decreases, your metabolic levels decrease. So we have to balance these out by increasing our activity levels. Otherwise, we are just going to blame it on age. Okay, I had menopause, I had age, I'm 60, I am going to gain weight. So we have to be conscious towards all this. Dr. Pyali is smiling because she is an example of a person who is refusing to age. She is aging so beautifully and healthily. So everyone should, we have a role model in her. Then there is pregnancy during which women gain weight. Quitting smoking is something I want to talk about. It is something that I am very passionate about, leaving tobacco. So a lot of people associate this with weight gain, that because I was not able to smoke and I was stressed, so I ate. This is true. So overall, leaving smoking is a very good habit, a lot of beneficial health issues. So we must encourage our patients to give up smoking. At the same time, tell them not to take up unhealthy eating. ये नहीं है कि they stopped having gutka or cigarette and now they are having bread pakoda every 1 hour. So that's also not okay. So then lack of sleep is very important. Then mental health issues are very important, because if you're stressed, then you reach out for comfort foods. So obesity is no longer a problem only of developed countries, unfortunately. India, in worldwide, obesity is the world's second most important risk for premature mortality, which is why we are talking about it. And it contributes to so many other diseases and comorbidities. And like I said, India is now known for both malnutrition and obesity, and especially in children. We all have seen scenes like this. McDonald's and Burger King and all the Domino's and fast food, everyone likes it. I must tell you that I love McDonald's burgers and Domino's ke pizzas, but portion control and doing it only infrequently. Cheat meals only once in a while. That has to be the thing. So the reasons are changing lifestyle, screen time, kids being sedentary, adults being sedentary, American style malls. In kids, a very important thing is pressure to study and do well in school, and parents rewarding their children with food. Okay, you get 85% marks in the next exam, I will take you to McDonald's to have the best biggest burger. So children start associating food, junk food, with the feel good thing. If you do well in this test, I will buy you a Coke. So this is a very important factor. It becomes a vicious cycle. Instead, give them something else as reward. That we'll sit and we'll play a game of badminton together. Let's have a family time and play a game of Monopoly together. Instead of that, if you're offering food, that becomes a negative vicious cycle. Then more time spent indoors, consumption of colas, like I said, and see now even in rural India, the percentage of people who are overweight and obese is growing. So now we come to the distribution of fat. I'm going a little quickly because this is a big topic and I don't want to go over time. So now we all know that apple shaped obesity is more important for health problems, because your fat is distributed around your vital visceral organs. So this is going to affect the person more, and there is going to be more cardiovascular problems in the person. So we've talked about BMI. So now we talk about waist circumference also, because waist circumference is going to measure this visceral obesity. So in males, waist circumference more than 102 centimeters. In females, a waist circumference more than 88 centimeters. This also varies, WHO and Asian cutoffs are different, but मोटे तौर पे these are the cutoffs. So these will define obesity and the health problems that come with obesity. And likewise, if we do a waist hip ratio, If the number is 1 in males or higher, that's a problem. If it's more than 0.8 in women, it's a problem. So obesity, increased BMI, waist hip ratio, they all lead to an increased risk, especially as we grow older. There's a deadly quintet, 5 diseases which go hand in hand. There's obesity, hypertension, diabetes, abnormal lipid profile, and insulin resistance. Now, as your intra-abdominal fat increases, your risk for cardiovascular diseases increases steadily. This is a straight line. This is not even a graph or a curve. So it's a linear correlation. So we have to be careful. Then metabolic syndrome is a cluster which brings with it a lot of risk factors. So metabolic syndrome, to understand it simply, also called as syndrome X, there are three things out of any of these which will make the diagnosis. There has to be abdominal obesity, a fasting glucose cutoff, high triglyceride, low HDL, the protective lipoprotein, and blood pressure also, which is slightly on the higher side. Any of these three, if present, they make up for metabolic syndrome. Along with all these, there might be polycystic ovaries, there might be skin tags, raised uric acid levels, fatty liver, or microalbuminuria. So it's a cluster of diseases which go hand in hand. Cardiovascular events in obesity are 2 to 10 times higher than in the normal population. Metabolic syndrome has an impact on all cause mortality as well as cardiovascular mortality. Diabetes in obesity has been found to be higher, and the control of diabetes worsens along with gain in weight. And as the diabetic person loses weight, their diabetic control definitely increases because their insulin resistance goes down. So there are so many problems which are associated with obesity other than just these. There is pulmonary diseases, there is obstructive sleep apnea, there is fatty liver, there is gallbladder disease, there are osteoarthrosis, means your joints are going giving way because of the added load on the joints. There is idiopathic intracranial hypertension, there are stroke, cataracts, heart disease, even some cancers, and then there are phlebitis, the venous stasis, and of course gout. So all these means that we must do something about this. This is something very important which I need to talk about because we are in COVID times, obesity and COVID. Now, a lot of people have complained to me, my patients, that because of lockdown, I gained weight. See, a lot of sensible people did not ever gain weight during lockdown. Lockdown gave us the time to still indulge in a healthy lifestyle and to eat mindfully and rightly. And at the same time, even in strictest like lockdown, you could exercise inside your home if you didn't have access to outside. So I would say that it's more an excuse. Look inwards. You can find a lot of YouTube videos about all sorts of exercise which you can do. Put that on, put on your playlist, whatever songs, bhajans, podcast you like, and exercise. Obesity on COVID, anybody who is obese or morbidly obese and gets COVID is likely to have more severe COVID disease. Prone ventilation is more difficult in people who are obese, which is an important thing when their oxygen levels go down when in a hospitalized COVID patient. And imaging is also more difficult in obese patients. So obesity has a bad effect on the outcome if you get COVID. So another reason to be very fit during this pandemic. So the overall impact is life expectancy is cut short by 3 to 7 years, and the time and money spent in corrective measures, is a lot. So
Mhm.
prevention in this case is definitely better than cure. So like I said, it's a lifestyle disease. It needs lifestyle modification. You need weight management. You need diet, exercise, behavioral modification. So number one in every disease is awareness. I calculate my BMI, I calculate my waist to ratio. I realize, okay, I am overweight, I am obese. I am at risk of these diseases. I have a family history of diabetes. Now let me look into this. So, and I must sit with my doctor or my dietitian, my healthcare provider, and have a plan for losing weight. So I get the right diet prescribed, I get the right, I think about the right exercise measures. And but if as a doctor or a healthcare provider, I feel that my patient is not aware and not doing this They may need behavioral modification. So lifestyle teams nowadays have psychologists on their teams to talk to people and modify their behavior gradually, explain to them why they need all this. Now, I'm coming to the end of my slideshow. So the good news is that even a 5 to 10% reduction in weight will contribute significantly to decrease morbidity. But too important is to maintain it. The weight loss has to be supervised by a doctor or a nutritionist, because yo-yo dieting, losing weight and gaining weight is not good. There are a lot of psychological sequelae. People get into body image disorders, etc. And then there might be gallstones, hypokalemia, raised uric acid, etc. So first a screening phase, then a weight loss program, then a maintenance phase when you have finally lost weight. And the weight loss goals for every person must be individualized, depending on what is their weight to height norm, what is their activity level, what are the comorbidities that they are expected to have or do have, etc. So this is a shift in paradigm. I think the nutritionists here will agree with me that the medical management of obesity has come to the level that we realize that people should be encouraged to lose even little bits of weight, rather than a person comes to me, I tell them आपको 25 किलो वजन कम करना है, आप अगले महीने मेरे पास आइए. We know that that is just going to make that person upset and they are not going to be able to do it. Give them realistic goals that even if you lose 2 kilos per month, it's fine. Do it gradually and lose at least 10% of your body weight. That's fine. And increase your exercise levels. Now I want to end with this because we talked so much about obesity, but as a physician and as someone who deals with a lot of adolescents, a lot of grown-ups, something positive I wanted to talk about. So there is something called body positivity. While we talk about the mal effects of obesity, we must remember that we have to fight the disease, but not body shame the person who is fat. As doctors, as nutritionists, as healthcare providers, even as family people. So body positivity means something that all bodies are beautiful. We must appreciate our body with all the flaws, feel confident about it. We have to help our patients, our family members, our friends also in doing it. That they should love themselves, accept their body's shape and size, yet try to eat healthy, exercise more, strive to lose weight, because that is something healthy and that they should strive to do. So the numbers of obese people are rising in epidemic proportions, especially the young. India number of bariatric surgeries has risen like anything. It used to be less than 10, it's now in 30,000s and even more. This has major effect on a lot of diseases. Costs of healthcare have gone up, and morbidities have gone up. So to take home, carry home, it's more a lifestyle disease. We have to catch them young, educate children about food. It should start with families, teachers, parents, that they should make eating a pleasant thing. It should be a healthy thing. Parents should try that kids have less screen time, more fruits, more vegetables, more fiber in their food, and they should eat while, when they are talking with each other. Make it a family pleasant time. Don't make it into a thing that I'm sitting in front of TV and putting whatever junk I can into my body, because my body is not a junkyard. And when you need it, then supervise weight loss and dietary plans. Children see what parents eat. Parental involvement and support is very important. If I have samosas day in and day out, I can hardly be telling my child, okay, you eat carrot. It's not going to happen. So ending with body positivity, practice body neutrality. When you talk to someone, please don't call them mota or patla. Say that you are looking healthy, you're looking nice. So try to practice that for others and yourselves. Eat healthy foods because it's good for your body. Buy and wear clothes which flatter the body that you have now, but strive to be better versions of your own selves. And this is what we should explain to our patients also. And replace aspirational social media accounts जिसमें ये है कि become like a model, look like a model, with body positive ones. So talk about gaining muscle mass, retaining your joint health, retaining bone health, retaining the cardiovascular health, having good numbers in diabetes in terms of lipids, rather than talk about only the mota patla. That is not important. Being healthy is important. Thank you. We cannot discover new oceans till we have the courage to lose sight of the shore. So we have to start with an ocean and build on it and be better versions of ourselves all the time. Thank you so much.